So yes, just allow me to introduce myself. I'm Linda Craig. I'm regional lead for the Regional Patient Client Experience Programme in Northern Ireland. And this is one part of quite a suite of programmes that we run, or initiatives that we run, to support people to share their experiences of health. And I was delighted to have been a finalist in the PENA Awards this year, but to be a winner was also a great shock to us, and has really helped us raise the profile of our work in Northern Ireland. So there's definitely ongoing ripples of appreciation when you're part of these award ceremonies. I've entitled my presentation The Golden Thread, and hopefully you will see that analogy unfold as I go through our presentation. But the sort of bottom line of it is that we all talk about having a golden thread in the health service. We all talk about, oh, that should be in everything. And really what I'm hoping for is that you'll be able to see that how engaging the public, engaging people from the very beginning, has to be a very clear and obvious thread through everything that we do. The main purpose of our project was to look at how we support people who use sign language to tell their story and tell of their experience, and allow of them to share with us their experience, and also support the community to make the changes in line with what they needed to see. And this is a quote from Charles Dickens from A Tale of Two Cities, and it talks about how that golden thread is about binding people together to that point of being a tightly knit community, family, close friends. And I think in essence that's what we found we had to do when we came up with this idea of, we need to go out there, we need to make our mechanisms more accessible for sign language users, because they were very clearly saying to us, we try to tell our story, but we don't believe anybody hears us, and we don't even know that we're communicating it across to people in the right way. So this was really important to us, to try and establish that sense of community, bringing together, and really to do that, it was much of what Sarah has said about establishing those relationships and going to the people and asking them, what do you need us to do in this space? And to be honest, when I designed this title of the project, Listening to Sign Language Users to Improve Access to Share Their Experience, it came off the back of a colleague of mine, Dalreen Masson, who's not able to be with us today, who was doing a piece of work with the Point of Care Foundation, and she needed to finish with a project. And I thought, you know what, this one's great, this is quite straightforward. And I nearly thought I was coming with the answer, and I was going, do you know what, take that answer out there, Dalreen, and ask people if that answer works for them. There's a great arrogance in that thinking, because what we did learn was that we should never come with the answer. We should never even think we have the answer, because when we really started to engage with the people of Northern Ireland who use sign language, we learned so much about them as a people, but also how we needed to build our relationships with them. The British Deaf Association were our keen and our key charitable partners in this space. But we didn't go alone with just the British Deaf Association. We did work with the National Deaf Children's Society and the RNID. So these are such valuable community and voluntary sector spaces that already had really good engagement. And what we knew was, by working alongside them, we could reach into the community and build those relationships and really work towards a really positive outcome. There was two things that really helped us in this space. So the initiative we were looking at here was Care Opinion, and we've had Care Opinion in Northern Ireland since 2020. It's the online user feedback service for Northern Ireland, and it allows people to give feedback on an online system, and it allows people to get a response from that service, which is, you know, been a bit of a game changer for our world. But Care Opinion in itself had a telephone number and a way of using picture tiles, but what it didn't do was it didn't quite reach that space of allowing people to tell their story in sign language and receive a response in sign language. And that's what people needed. That's what they wanted to see happening. And so we were quite lucky in the sense that Sign Video was another new contract in Northern Ireland, which allowed people who use sign language to use a telephone number, any telephone number relating to their care. And in this case, we're able to use Care Opinion and their telephone number. And what was the additional sort of challenge in our space was that when we went out to speak to sign language users, we knew the importance of translating everything from the spoken word to BSL, or from the spoken word to ISL, which is Irish Sign Language. And it was such an education for myself and Dalreen in terms of learning about different dialects and how things are said and the different languages and how that's interpreted and how you interpret sort of intent and emotion through sign language, that to use just things like, just a straightforward handwritten interpreter, you really had to have someone who understood sign language to be able to do the written word and to do it justice. So that was really important. The other really important bit was reaching across all of Northern Ireland. If you appreciate Northern Ireland, we do sort of run with quite a complex politics, but it was really, really important that we reached across the whole breadth of Northern Ireland. And this is just an example of 4 of the service user groups that specialise for either supporting someone who is deaf or a sign language user. And these were the groups that really helped us from the very outset to help us with, this is what we think the process needs to look like. This is what we believe we need to test of the process. This is how we need to change the process. This is how we need to promote the process. And can I assure you, the assumption that I started with is not what we ended up with. And that's wonderful in itself. So I'm not going to go through great detail of exactly what we did in terms of the finer operational bits of care opinion, but really to give you a sense of what did we set out to do? So we set to develop a mechanism for people to share their experience of health and social care. And we set to develop a mechanism whereby that response would come back in sign language. And then we sought to identify what mattered most to people who use sign language. And then there were some really important pieces we needed to understand around functionality. What were the opportunities? And that was mainly around sign video coming to Northern Ireland. And what were the gaps in resourcing? And the biggest gap that we did have in resourcing was having a deaf translator to take the written word, that being the response from a service, and turn that into a sign language video in both BSL and ISL. And that required some additional work around business cases and looking at what other resourcing we can feed into. It was essential that we piloted the process, and I didn't appreciate the importance of this pilot. This pilot was where I realised we actually had the relationship with the community, where they were like, absolutely, they trusted us, they let us use their stories, and they really leaned into the process and made it theirs. And that was really vitally important when we were reconsidering how we were taking it forward. And really we're at the final stages now, although we've went through a process and a redesign. We're now in a final stage where we're designing a promotional video. And so we have a number of our sign language users in that promotional video. And really we're doing it through role play, which wouldn't have been my first intent around promotion. I would have thought, is that right? But what was really important to them was seeing the role playing of the literally picking up the telephone, using sign video and walking them through the process. So I hope I've touched on a number of these underpinning principles that we have really seen that we needed at every stage of the project. And this is what I mean by the golden thread. It was so important to build the relationships. It was so important that there was an agreed purpose. And that purpose was very important because I was coming with my own sort of limitations to what we had available. I mean, money's always on the table, isn't it, in terms of we don't have all the resources that we might need. But to agree the purpose, to know what we were all striving towards, despite some of the limitations, was really important. Open communication was essential, and the last one is probably the biggest one for me, was the need to challenge assumptions. There was also assumptions from the community where they were going, well, actually, you don't want to hear our stories, you never listen to our stories. And that has come from a lifetime of them trying and really not the right mechanisms being in place. And so what was really wonderful was when they could see, when they told their story, how that changed things, how it made a difference. So one of our stories was a sign language user who during labour, during COVID, went in to have her first child. And because it was during COVID, her partner wasn't allowed in with her. But they also did not organise an interpreter to be with her. And she went through one of the hardest experiences of her life on her own, not being able to communicate effectively and say meaningfully what she had to say because she was profoundly deaf and nobody engaged in sign language. And that has resulted in a massive piece of work. And I think those are the sort of stories that people, she wanted to tell that story. She wanted to tell it in her language. She wanted somebody to listen, but more so, she wasn't doing it for any sense of complaining. She just never wanted that to happen to her or to anybody else again, which is a fundamental practice or principle behind why people tell their experience in the first place or get involved. So we're in the final stages, and I'm not going to overly labour this point. I think what I want to get to is kind of the final analogy of all of this. You know, we have come through this journey. We've come to review. We're working on the promotion work now, and hopefully we'll have the video ready for the new year. And we had everyone engaged in this cycle of learning from the very outset, which I think was crucial. But really, what I wanted to come to and why I entitled the presentation about being a golden thread. I hope some of you will appreciate the analogy of what happens. I'm not going to pronounce it because I don't do it justice. But in Japan, when something breaks, what they do is they rebuild it. And they rebuild it traditionally in gold. And they do that with the belief that what they're doing is recreating something more beautiful, but something stronger. Something of that appears different but has strength behind it. And the whole idea being that if we recognise the absolute importance, as we sit here today, we all probably sit at some point behind our desks and think, dear goodness, the system's broken. I don't think we can rebuild our system. We should definitely not try to rebuild it to make it look the same, because that's just the sort of the interpretation of doing something silly. Why would we do the same that we've always done if it's not working? But to rebuild it closely together, bringing in the partnership, making it much stronger, in recognising that the people that are in our service are the ones that will help us rebuild this and make it much stronger, I think is of crucial importance. And I think one of the strongest learning from myself and our team whenever we were out working on this process, and really our challenge going forward now is doing the same in everything that we're doing. I'd be delighted if anybody wants to connect with us on any of the bits of work that we're doing or have any questions that they need to ask. I've included our contact details at the end of the presentation.